Although there is no way to prevent or cure MS, there are many treatments available to help each patient manage the disease better and to help you lead a more normal, enjoyable life.
There's kind of three aspects of treatment. One is treating any acute relapses or attacks, and the mainstay for many, many years has been the use of corticosteroids if those relapses are disabling. There's also disease-modifying therapies that seem to actually modify the disease course, but they are most effective and are used primarily in relapsing remitting disease if there are frequent relapses. The other part of MS management is symptomatic management, and that's trying to optimize function and minimize some of the troublesome symptoms of MS, and that's a combination of non-medication strategies, including exercise, and medications that address individual symptoms.
Well, I would just say, of course, exercise, eating right, just try to live a stress-free life, having a good support system. I think if you could work, I know I was off work for a few months and your headspace doesn't go in the right area. Working is good in a sense. I mean, I'm glad I don't work full-time right now, but just having that release and not thinking about the disease, you know, being able to go to work and being part of your community and seeing others has been positive as well.
Oh, stress can make it very bad. I try really hard to manage my stress, to handle my stress, but when I do get stressed, I notice things shut down.
I just felt that if I sort of wallowed in pity, then it's not going to assist me in my recovery, and so I just wanted to make the best of a not so good situation.
What I would suggest is to get a healing team. You know, you have to come up with a healing team. And again, that could be your spouse could be on that team, your priest, your counselor, your doctor, your pharmacist, people you can talk to about the disease, and then some people who know a bit about it. It could even be your best friend who knows nothing about it, but just someone you can vent to, right? You don't want to leave it in. So you really want to get that out.
The treatment or management plan for MS is based on the type of MS that you have, as well as the symptoms you experience. In addition to adhering to your treatment plan and getting regular exercise, having a balanced diet is also very important. While there isn't a special MS diet, it is recommended that you follow the Canada Food Guide.
Well, I'd say that one of the things, the diagnosis of MS is a bit of a wake-up call, that one really has to put some effort into maintaining wellness. This is often young people who've taken their health for granted and now are faced with the disease, but it doesn't mean you can't be a well person with MS. I like to think people with MS, not to think of themselves as sick, but as a well person living with MS, and trying to incorporate exercise into your life is going to help keep you that way. When I talk to someone about a new diagnosis, we talk about some of the things they can do to keep themselves well.
The benefits of exercise for people with MS include improved balance and increased strength, which can prevent falling. It is also a very effective way to manage fatigue and other symptoms.